Hi, I'm your host, Marsha Florence for Just Ask Talk Show. Today's show, ladies and gentlemen, is Back to You. Hurry back and join us. Hi, I'm your host, Marsha Florence for Just Ask Talk Show. Today's show, ladies and gentlemen, is Back to You. And as I always say, is there a doctor in the house? And we do have one, Dr. John Putnam. Good afternoon, Dr. Putnam.
Good afternoon.
Glad to have you here.
Happy to be here.
Good. Now, I just gave the short version of the name, Back to You. So I'm going to leave it up to you to give out the whole title. So,
Okay.
Dr. Putnam, tell us what is Back to You and your involvement.
Back to You, full name is Back to You Osteopractic Physical Therapy and Rehabilitation. We do a lot, so we wanted to include a lot in the name. My relation is I'm the founder of the company.
Okay. So, now being the owner and the founder means you got a little history here. So tell us a little about yourself.
Myself, well, I have been a clinical director at various clinics throughout the Metro Detroit area. I did my undergrad at University of Michigan and grad school at the University of Scranton in Pennsylvania. And then I kind of bounced around different companies, and it was kind of the same old thing. You build up the practice, and it was way more seemingly monetarily focused and less patient focused. And so I would kind of go to the next place hoping for a different story. And enough is enough, and I had a vision in mind, and there's something I wanted to create. And that was to set the status quo for quality care in Metro Detroit. And the only way to do it was to go out on my own and create my own brand.
Okay, wonderful. So all that working for someone else, so to speak,
Exactly.
gave you the vision to be able to work for yourself.
Absolutely.
Okay.
Yep.
So what sets you apart from any other facility?
Our facility is based on what I learned to do differently from all my past experiences. We're the only osteopactic facility clinic in the Metro Detroit area. We also won National Clinic of the Year. So that alone, I mean, we were given an award because of our outstanding manual hands-on physical therapy skills. So being the only osteopactic clinic in the Metro Detroit area, we're able to also provide the same type of services at each location that you go to. So it doesn't matter if you go to Canton, Royal Oak, Grosse Pointe, you can get all the services that we'll talk about. And you won't know, at some places you might not know what you're getting into. Every clinician's so drastically different. But it's nice because some people work on one area, work in somewhere near Grosse Pointe, or maybe they live in Royal Oak and they can go to either clinic and know they're going to get the same quality care and the same services.
Okay, wonderful. And a lot of time when people think about rehab, they think in-house services. So, and you guys have that title in there. So why do you call it rehab?
Rehabilitation is just multifaceted. It can be post-operative rehab. It can be post-motor vehicle accident rehab. It can be just a fall, just some sort of trauma, or it can just be pain. It's rehabilitation. That's why we call it Back to You. We're rehabbing you from your current state to get back to the things that you love. A lot of patients kept saying, they might be ornery or short with us, but they later on apologize and say, I'm sorry, I'm not myself. So the whole goal is get them back to taking care of their grandkids, gardening, playing sports. It's the rehabilitation process. It's a spectrum. So I just feel like it's a multifaceted, all-encompassing kind of word for everything that we do.
All right. I like the name Back to You, so that helps a person feel more comfortable to get back to their normal routines if all possible.
Exactly.
Okay, so in the event, what type of treatments do you offer?
The list just keeps on going. Everything from, we have craniosacral therapy, we do spinal manipulation, similar to a chiropractor, we can adjust the spine. I can essentially crack everything in the body to loosen up the joints and the muscles. We do dry needling, which is a similar technique to acupuncture, but it goes a little bit deeper. We'll talk about that later. We do cupping, we do body tempering. We do just your traditional PT, the exercises, neuromuscular re-education, balance, vertigo, dizziness, blood flow restriction therapy, where you can load the muscle and do way more, fewer reps but get bigger results. We do IA stim, so tools, scraping tools to kind of loosen up soft tissue. We can talk about that later.
I saw those tools. I
Yeah.
wondered about that. Okay, I was wondering what that meant. Okay, okay. So it sounds like a wide variety of various services, but the question I have for you is that how would a person know what they need? I mean, a physician writes the order, true enough, but when they come in there, is it based on what the order is asking, or how is the treatment actually set up?
Yeah, I don't think they always understand. Sometimes the doctor will just say, go to therapy, and they'll say eval and treat. They kind of leave it up to us to dive in. And I'm fellowship trained, so I have been trained to rule out all the different possible diagnoses and really figure out what is the underlying issue. And we do special tests, some that are even better than MRIs. So a lot of patients will kind of get these MRIs and it'll show things, but those are normal age-related changes and not really the pain generator. So we'll get a script if they have pain, if they have imbalance, if something just isn't them, they're not quite right, they feel something is off, weakness, imbalance, tightness, whatever it might be. It's not always just pain, but they'll go to their doctor and say, hey, I want this addressed, and the doctor can write, imbalance, gait training, whatever it might be. And a lot of times, and we talked about this earlier, they might come in with a script and the actual diagnosis code is something totally different.
Yeah.
And I'll ask them, so we're treating your back today? And they'll say, no, I told the doctor my neck. That's okay, I'll evaluate your neck. We have direct access, I'm a doctor. I'll make sure you're safe, and that we can treat your neck today. I'll call your office. I'll make sure we get a new script. I'll include that correct diagnosis in the plan of care. And I also hear that you mentioned your knee, your shoulder. We'll put those on the plan of care too, so we can treat and address every issue that you have.
That's great, because a lot of people get confused about how their treatment goes. So I tell you what, we're going to take a break and we're going to come back with some more good information about Back to You.
You're there for them. We're here for you. Find free care guides at aarp.org/caregiving.
If you love them enough to suck the snot out of their nose at 4 a.m., then surely you'll check nhtsa.gov/the right seat to make sure they're in the right car seat.
And welcome back to the show. Now, ladies and gentlemen, you know me. If you're just now tuning in, get your pen and paper out. I know you have some questions for Dr. Putnam, and you want to know more about Back to You. So first of all, I want you to know, anytime you have a question for any of our guests, you can always reach us at 1-800-323-5336. That number's at the bottom of the screen, 1-800-323-5336. Or email me, Marsha at Just Ask Talk Show, Twitter, Just Ask Talk Show. So anytime you have questions for any of our guests, Dr. Putnam, or anyone that you are interested in knowing more about, just look us up and we will get that question over to them and connect you with them. All right. So Dr. Putnam, people are excited when they see doctors, okay? And you are in the position where people who are saying, I am tired of taking pills. I don't want to take any more pain pills. I just want to get better. What is the age range that you work with?
Pretty much everything from young adolescents, teenagers, to geriatric population. We've treated professional athletes, Olympians, but we also treat just someone that wants to bend forward and tie their shoes. So literally anyone. And it's my belief that everyone could use physical therapy services. A lot of times they don't realize it. And our extensive evaluation will find those underlying impairments that people don't really realize are going on. A lot of times they'll kind of add up and work themselves out until it becomes a serious problem. And we don't even realize it's very insidious and kind of creeps up on us. So we'd love to find those before they become real problems.
Okay, okay. But you know what, I want to know, a person doesn't necessarily have to have a slip and fall to want to come to a program like yours, do they?
No.
Okay, but it has to be a prescription order.
We want a prescription. We have direct access. So if they want to use cash, they can use that. If they want to use their insurance, they need a prescription to come in from any physician of theirs that is aware of their condition.
Okay, so what type of insurance do you take?
We take pretty much everything. Our goal, it's in the name, back to you. We're a hybrid practice. We take cash, insurance. We take Medicare, Blue Cross, Blue Care Network, HAP, auto, work comp, United Healthcare.
Right.
I can go on and on and on, but it's on our website.
Open the door. Okay.
Yeah, our goal is to get a network with every single insurance in Metro Detroit because we want to be able to help as many people as possible.
You know, because I asked that question because a lot of people who are on Medicare or Medicaid, they say that, oh, they're not going to take my insurance because I don't have that,
Oh, it brings me such joy when they call and they say, I have Medicaid, do you take that? Absolutely.
Yes.
And they're like, no way, because they're looking for these specialty services that we offer.
Right.
And they're not, so when they find someone that has that, it just brings them joy. So
definitely. I mean, I don't see why, all the insurances are just not included in, all practices. I mean, there's probably a good reason, but, I'm sick or I'm not feeling very well physically or emotionally, and I want to seek services, but I'm set back because I feel as though my insurance will not be able to cover the cost. Then I'm, getting worse. Okay, so a lot of times we need to know, right off the cuff, what do you take? Can I come there?
Yeah.
And so if that's what you take, everybody like, I got to go over there to that service right there because they take my type of insurance.
Exactly.
That's great. That's great. Okay, so we probably get some calls after this.
Awesome.
Okay. So, like in the event that someone comes into your office first time, is there a normal evaluation or assessment set up, before you actually get into the actual physical training or breakdown of a person?
Yeah, absolutely. Everyone is evaluated by the doctor of physical therapy on staff, and they'll rule out red flags. They'll make sure that the treatment's safe for them, that they're appropriate. 99.9% of the time, they're in the right place. And we'll check baseline, range of motion, manual muscle tests, like their strength. And again, rule out red flags, check out the neural dynamics, because so many issues that we have don't show up on imaging. Muscle spasms don't show up on MRIs. So, or if a nerve's caught up somewhere, and we can figure out where that's happening by different special tests, it's not going to show on imaging. So we do a very thorough neurological soft tissue examination, and we also initiate the plan of care. So we give them a home exercise program. We have our own application, so they can hop on their app and they have videos and they can go through all their exercises. That started day one, and we start the hands-on manual therapy treatments so they feel better day one leaving our clinic.
That's great. That's really great. Okay. Now, what is the oldest client that you ever serviced?
Over, I think 102 was probably my oldest
Really?
one, yes.
Okay. Yeah, I used to do Pilates, and the gentleman there, he was 88, and I used to look at him and I said, if he can do it, you can do it. So
Absolutely.
I just wonder,
Yeah.
but it's I like the idea that someone of age still keeps in mind that I need to stay physical, and when you're physical, it helps with the cognitive level as well. So.
Oh, for sure.
Yeah.
Yeah, every treatment's catered to the individual and their physical level and their goals, which is more important. What does that patient want to do? We cater the treatment to get them to their personal goals.
And so you guys have, 3 or 4 facilities? I know I heard
Yep.
you say something about Canton.
Yeah, Canton, Grosse Pointe, and Royal Oak, and then we also just opened Port St. Lucie in Florida as well.
Okay, Florida.
Yes.
All right, I can take a trip to Florida.
Yeah.
Okay.
For all the snowbirds
It's
out
already
there.
warm there. All right. All right. And what, the idea that now, let me ask you this. So if a patient comes to the Royal Oak office and just so happen they are in Canton, can they come over to the Canton office, or they're stationed at that one facility?
No, I've had people come. We used to have one in Flint. They bounced around to every single one, either to see me or whatever's convenient for them.
Because your records goes where?
Yeah, it's all central EMR. So if someone had their dog at this one animal hospital that happens to be by Canton, they can go treatment there, and they can all see, the clinicians can see all of our notes, And we have Teams communications too, so we can give them a heads up and say, hey, I'd like you to focus on this patient. They're coming to your clinic today.
That's great. That is really great. Yep. A lot of people say, I'm traveling, I can't get to my facility, I'm gonna miss my appointment, I won't be able to go. But if you have it where it's convenient for them to go from one location to the next because they just so happen to be on that side of town,
exactly,
that works. But is that appointment graded too? I mean, do they have to have an appointment? If I miss my appointment in Royal Oak?
you have to have an appointment.
Okay.
Absolutely.
Okay. All right. So we don't just want a person to say, well, I miss Royal Oak, I can walk in over here.
Yeah, well, they can call ahead and there might be an opening or a cancellation. They can hop right in, or I definitely accommodate people quite often in those circumstances.
Okay. What are your hours of operation?
Most clinics are open Monday through Friday, 7 to 7. We try to catch people before work and after work.
I know about that 7 a.m. and I'm trying to figure out who goes to therapy at 7 in the morning.
It's actually some of our busiest times.
Yeah. So you can tell I'm not a gym person or any of that. Like 7 in the morning, really? But I'm getting there. Okay, and that's a good thing to know that, operation is 7 to 7. So those of us who don't get up in the morning can go in the evening. And those who
we'll catch you on the later shot. Yeah,
get off in the evening and still go. Oh, okay, that is wonderful to know. Do you guys offer any particular services in alignment with persons with disabilities, such as the wheelchair user? Sometimes people, in wheelchairs need to have some form of physical therapy. Does your program offer anything in that arena?
Yeah, all our facilities are ADA compliant.
Great.
And we were just talking about the gentleman in the wheelchair doing exercises, and we have a patient like that in Canton. We have spinal cord injuries, so neurologically dysfunctional individuals to fully functional. It doesn't matter. We just accommodate. We have sliding boards for the wheelchair transfers. We have parallel bars for imbalances. We have tons of different options and equipment to accommodate for everyone. We never know what's going to walk in our door who needs our help. So
and that
we have
makes
to be ready.
our friends in wheelchairs happy to know that. Okay.
Absolutely.
Okay. Our spinal cord injury friends will be glad to hear that.
Yes.
Okay. So I tell you what, we're going. I know y'all said another break. Yes, another break, and we'll be right back again. Back to you. We'll be right back.
Bye, Janet. It's nice seeing you again. You look good, girl. Just let me know what I can do to help.
Well, to help me, she'd have to help every day. Every hour, every ouch, every time my wife calls for help. I mean, maybe she could help me make her lunch. But the crust, all the crust has to be cut off the corners. She could help me run to the doctor for the 5th time this week. Help me with the specialist and the second opinions and the painful paperwork about paperwork. Help me deal with how hard it is seeing my wife's name on so much paperwork. But this is on me. I'm the only one who can do this, like this, for her. Besides,
Take care.
we will. Janet doesn't like her cooking anyway.
Find support for your strength. Visit aarp.org/caregiving for care guides and community.
If you love them enough to drive an hour to cheer them on as they get beat 11 to nothing in the rain, then surely you'll check nhtsa.gov/the right seat to make sure they're correctly buckled in the back seat. If you love them enough to crawl into a play place to get them to come down, then surely you'll check nhtsa.gov/the right seat to make sure they're in the right car seat.
And welcome back to the last half of the show. Now, ladies and gentlemen, like I said, get your pen and paper out. Dr. Putnam is going to show us some of these wonderful photos of the work that they do over there at Back to You. So, Dr. Putnam, I'm just glad that you had a chance to elaborate on what you do, but now we need to see some photos so people can actually follow and see what it is. And they say, oh, yeah, I think I want to try that.
Yeah.
And I know the one that I was always curious about was needling, or is that acupuncture? What do they call that?
They call it dry needling.
Dry
Yes.
needling. Okay, so I need to take a look at that and see, if you can give us a little information about that. So is that what we're looking at? Is that dry
That
needling?
is, yeah. So it's very similar to acupuncture. These needles are about 5% the thickness of any kind of injection you would normally get. So they're super tiny. But what they are doing is they're trying to release muscle tension. Also, we go along nerves to help with things like carpal tunnel syndrome or headaches. And with osteoarthritis, you can go down and tap on the bone and stimulate cartilage growth and actually stop the cells that cause degeneration of bone. So arthritis, nerve issues, muscle spasms, general pain, we're very focused and targeted to the problem area, the pain generator, as opposed to acupuncture is more aligning the chi, the energy flow. So they might be far away from your area of concern. And this is way more evidence-based. I conducted a lot of the research studies. I assisted with those. And we'll actually hook them up to electric stimulation, which is like kind of a little pulsing or massage in the muscles.
All right. So a person can either say, they can say acupuncture, but there's needling. Needling is
Two different disciplines. I'm not an
Okay.
acupuncturist. I'm certified in dry needling. So it's intermuscular focus as opposed to chi focus. It's Eastern versus Western medicine.
All right.
But doctors of physical therapy do dry needling. Acupuncturists do
dry needling.
acupuncture.
All right. And so what's the next photo we see in here after get through playing with the dry needling? Now, this looks like this hurts, I hate to tell you.
This is body tempering. You'll hear patients that say they have their kids walk on their back. They want someone to dig an elbow in their muscles. So this is created by Donnie Thompson back in 2014. He introduced it to the Philadelphia Eagles. They won the Super Bowl that year, and it reduced soft tissue injuries by 30%. So it's basically loading the tissues enough to cause an actual permanent change in the length of the muscle. So it's more effective than both stretching and massage.
So that's like, is that rolling something up and down?
Yep, we roll up and down the muscle. We find those trigger points or those knots, the focal tender spots, and we hold it, and we have the patient activate the muscle, lengthen it, and elongate it, and shorten it, and then the muscle just immediately starts to release.
Because I have Charlie horses. When I saw that, I'm like, no way. Okay, I'm like, I stretch in the morning, and all of a sudden my muscle in the back of my leg, I'm like, oh, Marcia, you didn't drink enough water today. Okay, or my bananas, whatever. So that would probably, be one of those. I'm like, no, thank you. Okay, so now what do we have here?
This is IASTM, instrument-assisted soft tissue mobilization. So we're using metal tools to free up any adhesions. When our body has trauma or injury, we scar up, we heal, and it's not always the most oriented way that the fibers heal. This allows them to reorganize, and it actually causes more collagen fibers in the muscle. So you break up scar tissue, can free up nerve roots. You can desensitize the area. Sometimes you touch a patient, they're really sensitive. They want to pull away. That calms the brain down. It makes it less hyper-focused on that area, because you can be healed, but the brain-body connection is still well intact. So the brain's still protecting that area, and we're telling it it's going to be okay. The area is healed. Let's calm this down.
I know we have a photo of the tools themselves, because I kept looking, trying to figure out, was that a spatula or something?
Yeah,
so,
it's like a cooking tool.
Yeah, I wanted to see that. So what is this here?
So this is cupping. This is static cupping where they stay on. I'm sure you've seen Michael Phelps with all the bruises on him. We also have dynamic cupping where it glides, or silicone cups, and it feels like a deep tissue massage. So we're pulling out lactic acid, toxins out of the area. So that area that we're treating, they could be trapped on the nerve, the muscles and spasms, so it's not getting the nutrients that it needs. So when we do this, it might leave bruising because that area is just not getting enough nutrition, oxygen. So we're pulling the bad stuff out and allowing good circulation in so the body can heal itself. So the more and more you do it, you get less bruising, more mobility, more flexibility.
And that's called cupping?
Yep, that's cupping.
Okay, now does it go directly to the area of concern where the person, the muscle is weak at or something?
Yeah, absolutely. We go right to the source, and if it's too sensitive there, we'll go around the eye of the dragon, so to speak, and we'll gradually work our way to that focal area. It's all based on what the patient can tolerate.
Okay, what they can tolerate. I mean, she looks like she's enjoying it, but I'm like, when you got the bruises to show me, okay.
Yeah.
So I know we have another photo after that, and now that looks like something I can handle, okay. Twist and turn me.
Yeah.
Okay, so that's what?
So that's spinal manipulation. So it's a high velocity, it's a safe mid-range pop. We do it the entire spine. It's safer than even checking your blind spot while you're driving. But we're basically bringing the joint to the end range and getting a pop or a cavitation to get the muscles to let go. It improves the height of the discs between your vertebrae. So you actually technically get a little bit taller. The disc absorbs more water. The tone of the muscles relax. If you have muscle spasms, you have more flexibility, more mobility. So if you feel like you're stuck and you can't quite rotate all the way, this will clear out the rest of it.
I like that. I like that. Okay, so now do we have another photo after that? I believe we do. So let me see. Yeah, those
Those are the
tools
tools,
look
yeah.
like something in the kitchen. Okay, so those tools are what now?
That's the instrument-assisted soft tissue mobilization, or IASTM. There's a lot of different brands, and we use these Frams tools as one of them.
Look like a personal case for.
Yeah, it's a nice little
cooking
case.
or something, but
They were
okay.
created by the organization that I got my fellowship through. So they're
Okay.
all specially designed based on the tolerance of the patients, left or right. It's less aggressive to more getting in the nitty-gritty areas that need. So again, it's all based on the patient's tolerance. We'll start off slow and we'll work our way in there.
Wow. Now, will a person know exactly what it is that they're asking for, or do they actually get a chance to see these items and say, hey, I want to try that?
Yeah, we get a mixed bag. You know, some people that think they know what they want, and I'll have to educate them and say, it sounds like this would be the best course of action. But the beauty of it is that everyone, even though the evidence says do this, everyone's different. Everyone's circumstance, everyone's belief systems are different. So you got to find the right recipe for that patient, the right treatment that they really respond well to.
Okay.
So I'll kind of go with based on the findings, what would be best for them, and if that doesn't work, we have so many backup options to work ourselves through.
Well, it looked like you got quite a few things to choose from, so I don't think anyone will deny that they have options there.
Yes.
Okay, so, and I just love you guys signed your logo and everything back to you
Thank
with the
you.
alignment. I think that's really, really nice. So I'm sure you're easy to find when you have that type of logo showing the spine. So that's
Yeah.
great. Great.
But we
And-
treat everything from head to toe. It's not just the back, but that's just the most common thing that people deal with. So you want to, it's a double entendre. It's the spine, but getting back to that, what the things that they enjoy doing too.
all right, and I'm glad you said the toes was in there because some people.
Oh yeah, head to
say-
toes,
Yeah, head to toe.
and all the arthritis in between. Yep,
Okay.
everything.
Okay. All right. Well, wonderful. Well, you know, Dr. Putnam, I don't want to take a lot of more time up. I want to bring up one of the flyers here and let people know that if you have a question, I mean, I don't know if you can see this beautiful flyer, but we will post it up just the same. And I was just concerned about looking at the back. Look at the back of this, ladies and gentlemen. Look at all those wonderful photos
Different
there.
treatment options. Yeah.
Yeah, because that's all we were just talking about.
Yeah, we're trying to be a one-stop shop. We're just trying to emphasize that we do some things that a chiropractor does, an acupuncturist does, and traditional PT, all in one location, so you don't have to bounce around.
Okay, well, great. Well, will you come back again and join us?
I'd love to.
All right, now next time you come, we have to try some
We'll
of these things
demonstrate,
out.
yeah.
All right. Thank you so much. Well, ladies and gentlemen, you know, I always enjoy myself, and I'm hoping that you did as well. Get some resource information that you or a loved one or a neighbor may need. So at any time, feel free to give us a call. The number's at the bottom of the screen, 1-800-323-5336, Twitter, Just Dance Talk Show, or email me, marsha@justdancetalkshow.org. I'm your host, Marsha Florence for Just Dance, and what do I always say? If you have a question about a person with a disability or just a general question, don't be afraid to ask. Just ask. I'm your host.